Our county commissioners are brought to us this morning by Marcus and Mack, a law firm representing injured people. At last count on the line so far were Mike Keith and Robin Gorman. I don't know if Shireen has joined the conversation yet, but good morning to everybody on the call this morning. The commissioners asking if they could maybe spend a half an hour of time with you to talk about the COVID-19 pandemic, our response to it, our need to support our local businesses. Mike Keith, I'm going to ask you to kick us off and lead us into this conversation.
Sure, Todd. And again, thank you very much for giving us this opportunity to reach out and speak to the residents of Indiana County. I do want to speak on the COVID-19 pandemic to an extent, and then also move on to supporting our businesses, and then after that, maybe if we have any time, we can go ahead and lead on to some of the things that maybe happened this year in the county and some of the things that we're looking forward to do in 2021. But just to start off, the pandemic, as we've all been into now this for 10 months, it has been a year of uncertainty, especially when it first came out. And it's been an uncertainty in many fashions. Who would ever think that this would actually put a domino effect throughout not only our county, our Commonwealth, but the nation itself? Something that we truly did not understand at first. Today we have a lot more understanding about the virus and how to deal with it, and as read in last night in the Indiana Gazette, that the antibodies, but the vaccine is being received, at the IRMC. We put last week we drafted a statement and put it out for a press release, and that is going to hopefully be put out very shortly. But in there was a lot of things and a lot of places to actually go to find information. We heard from many of our residents of Indiana County and many of our businesses, and just throughout about, what do the numbers mean? Why are they so skewed? Why I see my numbers coming from here, but I get different numbers from there. The county from the beginning has stated, and has until this today, we continue to say we're following the Department of Health and the CDC guidelines. Those are the two things where we refer to our numbers. Now, yes, you can look at numbers and get them differently, but the way they're being reported, I really believe that if you dig down deeper and everything actually goes back to the DOH numbers that actually support everybody's numbers. And believe me, we've heard from residents in the county who have been doing a good job of tracking it in their own way and actually diving deeper into it to give us more information. And there's been people out there willing to do things that they can do to help curb this pandemic, to get over it. And we listen to them and truly appreciate for all their efforts and everything that they bring to the table. And there is nothing that we actually put to the side and we, do not listen to. But going into 2021, with the vaccine and everything, we're all praying and hoping that we can get over this thing and continue, through our everyday life. And again, is our everyday life going to get back to where it, we were used to having it? No, and it's going to take a while, and surely just like everything else that we view in some shape or form that we've seen in this pandemic. But I need people to realize that we ask you, please, look at the guidelines and wear your mask 6 feet away, wash your hands. All those good things so we can get through this. It puts a very big burden, especially on all of our healthcare systems. And what I mean by that is our hospitals throughout the nation are being overwhelmed. But in the same thing, if we do our part, we can assure that if there's another illness or maybe someone who would have a heart attack or a stroke, there's still a bed for them that these hospitals, still have to help their needs also.
Well, if you don't mind, Todd, I'll take it from there.
Okay.
Mike, if you want me to.
Sure.
So I, of course, was listening to your show earlier, Todd, and I am going to quickly tie this right to our response to COVID. So for those that are listening, I want to share some good news first, because if you don't know, and you can't share. So I want to congratulate Renda, you, Todd, and the entire team for receiving Employer of the Year from our Tri-County region, and you have been recognized, of course, throughout the region for your great work, and that's just another thank you for allowing us the time this morning to reach out to our county and our residents. And I just want to get another congratulations in there to Mark Hilliard and the Chamber for being Chamber of the Year, and that is another testament to the great work that our agencies and nonprofits across our county are doing even in the toughest times. You also had someone on this morning, Janice Kaplan, that wrote a book about gratitude. And so I want to start into this pandemic. As a county commissioner in January, when we were just starting to hear about it, and then March just sort of being thrown into the phrase of this, we could have sat back and did what so many leaders do. We could have pointed to our state leaders and our governor and said, "You're not doing enough." And we could have said, "You're not communicating. We can't connect with you. You're not using the front lines in our counties out here." And we could have talked a good talk and basically acted or done nothing. We could have pointed our finger and we could have blamed the borough for not doing enough. And all of our boroughs, not just one borough. We could have pointed to the townships and saying, "What are you doing? You're closest to your residents. You have community centers and fire halls, and you know your people. How are you communicating to them?" And so in essence, we could have passed the buck and we could have blamed others instead of taking our own responsibility. And here's the key: pulling all of our leaders together to work together to say our residents are all of our residents, and we owe them this. We owe them to come together and understand what we're dealing with, understand and respect each of our positions and our agencies or whatever we have with protocols, and then figure out solutions that we can offer to our people and provide accurate information and be in this truly together with them. So that's what we did. And obviously there was a lot of time spent like as Commissioner Keith said, really trying to get our hands around what are we dealing with, how do we do what our best information and data is telling us, which is mitigate this thing as much as possible right from the beginning to keep the surge off of our hospitals, to keep people safe and healthy. And so we started to tell them, each a little bit separately, but everybody was doing their part. The borough was trying to make sure everybody understood masking and why that was so important, and all of the other things that CDC and Pennsylvania Department of Health were putting out there for us to use for people to keep safe. They were also, because in the early days of this, the kinds of channels or mediums of communication, such as social media like Twitter and Facebook, were putting out information, and I don't think it was intended to be harmful, but it was actually parents sharing with parents about things they should have their children do that were absolutely dangerous and unhealthy. So our leaders, working with our state government, even all the way up to our federal with resources, were saying we need to have one safe, critical, integrated communication that we're reporting numbers through, they're reporting back to us, and we're all working together for the right, accurate, safe information, and that was the Department of Health. And then The Department of Health, and working with the governor's office, also said please use CDC or Pennsylvania Department of Health. So let me address the local issue of, a lot of people are saying, there's great information out there from well-resourced and experienced people who are taking the time to put data in charts locally. Why aren't we using them? And I'm not sitting back saying, oh, we can't do that. We're sitting back talking to our residents who are willing to step up and be helpful and talk to our partnership about, is this possible? Can we put a link off of our website that says, local citizens group information or data collected by, sourced to them that is not linked to what we've agreed to, which is one source of, again, safe, accurate, and as timely updated information through the Pennsylvania Department of Health and CDC. Many of our entities, like our hospital, our emergency management agency, they're very heavily regulated, and with confidentiality, of course, of patients' rights and information, it's very difficult for them to sign on to a group and say this group is going to act outside of us, and they're going to offer local information that might confuse more people rather than be helpful and align to, this consistency of message and what we're all doing collectively. And if one of our partners says, we can't be a part of this if you allow that way, then we have to find another way to thank our citizens for being engaged and concerned, but also educate and explain why we can't just say, oh, yeah, we'll post that. Oh, yeah, we'll share that. And that is not to say that they're not offering good things and that people are getting it anyway. They are out there on Facebook, and they're offering their own sources, and it's local sources, so they're getting it. But sometimes those numbers have a lag time between what our county has to report into the Pennsylvania Department of Health, and so already you've confused people because if they're looking at both sites and they're going, well, this information doesn't match up, and then they become, who do you trust? What's the most accurate information? And that's why we don't really use or interface with a lot of those mechanisms, only to push messages out, not to confuse people. The other thing I want to tell you is many people have called our office, and I am grateful that when a call comes in, regardless of whether they start out and they're one of those negative people, and sometimes I can't always make them happy, but most of the time people are very just concerned and they want information and they're willing to hear you out and talk about it. And I said to this one lady who called, let's go back before COVID, because she was talking about many entities, the newspaper, the hospital, our offices as leadership. And I said the hospital on a regular basis in our community is monitoring their patient base every day. They know how many they have on each floor. They know who their names are. They know what they're in the hospital for, and they monitor that all the time. In COVID and a pandemic, they are, of course, I put it, monitoring in ways that you can't imagine on steroids, as in every day, sometimes a couple of times a day. They are always in contact with our jail, with our nursing homes, with our coroner's office, with our emergency management agency, and this is something people never see. They just interact and function with these folks all the time. The police department, the drug coalition, you name it, the list goes on, mental health providers. These people work together every day. Now they're working together for our residents almost on the hour. And I was explaining to her that our hospital is the first one that's looking out for, if we get a surge, how do we move patients, or where to, or what facilities do we have as a backup to continue using and helping our residents and servicing them in their most vulnerable time of need. And then our coroners, interfacing with that, and our emergency management agencies, and everybody is helping and supporting and to do everything we can be doing to alleviate this problem and get rid of it. But in the meantime, try and communicate and help everybody do their part in the only things we know right now to do to try and mitigate and get these numbers down.
Okay, that's Robin Gorman, our county commissioner. She had a little difficulty getting onto the Zoom call, but she's here now. Shireen Hess joins the conversation. Shireen, good morning to you.
Hey, good morning, and I apologize for being late. I'm not sure what happened, but I'm here now, and I thank you for waiting for me.
We've heard from Mike and we've heard from Robin their thoughts on COVID, on information and getting it out into the public, getting accurate information available. Of course, the county took a great big step in that direction with the introduction of the website a couple of weeks ago. Shireen, your take on our conversation this morning.
Well, the website is a great first step. It is just the first step, and we want people to know that you don't just have to go to a website either. There are many services that we have in the county and with our many partners, and I'm very concerned about the next few months, especially if with the unemployment compensation insurance situation, with food insecurity, with housing, child care is a real problem for many people, with the schools being online. All of the issues related to maybe domestic violence and child welfare and depression and anxiety, and all those services that exist in our county to address those issues are pressed right now, but they are still operating at full speed. And so, if people are hurting during this pandemic and experiencing the emotional stress and the other hardships that go along with it, we want them to know that we have our County Department of Human Services and our Indiana County Community Action Program, and the United Way, Pennsylvania 211. If people dial 211, there's somebody on the other line that will connect them to whatever vital service they need, at the local level. Now, these systems are, as I say, they're pressed. So people, you have to be patient when you call into these numbers. And they're all on our websites, or just call the courthouse, and we'll get you connected to them. But there is help out there, so we want people to know that it's a very tough time. But there are things out there that we can help them with. So I guess I don't want to repeat things that I might have missed, but that's my message for today: is nobody has to go through this alone. We know we are isolated to a great extent, but there are ways to connect and ways to get help. So please, we'll try to reach out as much as we possibly can, but just ask people to call us and we'll find a connection for them.
All right. Mike Keith, we began our conversation talking about responses to COVID. We want to turn now in the direction of our businesses, the ability that Indiana County has that maybe our people don't know about, to be real supporters of our local businesses. It is so key, so vital for us to keep these folks in business, because these are our friends, they are our neighbors, they are us, aren't they?
They sure are, Todd. And one of the things that, besides following what COVID's doing to our healthcare systems and everything, the other thing that we have to do is we're out there looking and following what's happening to our businesses out there. I actually have businesses out there that have agreed to kind of be like watching what's going on around their area throughout the county. And it kind of gives a sense of, a direction of what is going on. And I actually either meet with them person to person or call them on the phone in the evening, and just to, get a sense of what's going on. And there's so many businesses and so many different variety of businesses that this pandemic has affected them in so many ways. And first of all, my conversation last night with some of them were, it's our restaurant business. The people in the restaurant business have really, really taken a hit on this, and it's I guess what the governor has put out so many times, they're the first ones that actually are the ones that get hit. I strongly, and every time I see people and talk to them, that's not only, but doing your safe distancing and your mask and everything, but the other thing is supporting these businesses. You know, whether it be a downtown Indiana or anywhere else, Blairsville, Homer City, even Cookport, Pennsylvania, little restaurants out there. I continue to ask, support your businesses. These restaurants, they are trying to survive. They're in survive mode. Takeout meals, listen, I understand it's a cost out of your pocket, but they need your support. So if you can, I urge you to continue to call. Takeout meals is great. This is a season of holiday giving. Buy gift certificates, you know, from those restaurants and, you know, give them out. But the thing I want to actually pose to you, and this is going to sound crazy, but last night speaking to one of the businesses, they said, it's great to buy the gift certificates, but if you just take those gift certificates and whenever we get past this pandemic, later on this summer, use them then. But right now, if you could, put the gift certificates away and pay cash. Cash is what's going to help them bring in the revenue to survive. So urge you to buy the gift certificates, put them later on for another day, but pay cash so they can actually have revenue coming in. But, you know, the county, the commissioners, we will continue to, you know, help these businesses in any form or fashion. Byron Stauffer has many things out there to offer these businesses in different ways and different forms. But again, support your businesses, be in downtown or anywhere else in this county. They need your help.
Shireen, Robert, you would, or
Yeah.
Robin.
Yes, Mike. Yeah, Mike, you mentioned that this is the giving season, and we really need our congressional representatives to push for COVID relief bills that are being talked about right now. These dollars that would help state and county and local governments support their communities are just vital at this time. So we're really hoping that our representatives will kick it in and pass a relief bill very soon, because we have had an unprecedented loss of revenue, as every local government has, and we need that relief. And people, homeowners and parents and families and individuals need some kind of a stimulus to help them through these next few months.
Yeah,
it's going to get tough, and we need that. We need them. This is the giving season, so come on, Congress, help us out here.
I agree with both of my colleagues, Todd. Supporting our local businesses are essential. Support for us and our local governments and services, and again, to our most vulnerable populations. That's what people don't understand. Our services are government services, but they serve everyone. They are there, they're working, they're taxed, as Shireen said, with regard to, you know, they're being overly taxed and used right now, but they're still there, they're still working for all of our residents. And we do need that support from congressional and state leaders to, you know, look at their local boroughs, townships, and counties and say, you know, we can't just leave them out there on their own to do all of this. And one of the things I want everybody to hear is that our partnership and reach and our borough partners, and like Mike said, we're in communication with our businesses, and our businesses are trying desperately to do their part. They understand that we are divided with our population with regard to wear a mask or not wear a mask, or what if somebody comes in without one, and then other people are afraid because they don't have one on. And so they sent out a letter, and basically, you know, it's through education and advisement and again, just trying to get everybody to work together to do the right things, to have patrons come into their businesses and feel safe and respect each other while we get through this together. So I know that's a very controversial topic, but again, we're just asking everybody to look in the mirror and say, you know, do your part and be responsible and respectful of other people while you're out, to not bring it home to your loved ones or them to theirs. And Todd, I just want to end on two things, and maybe my colleagues would like to speak to this, but, you know, everybody's talking about the vaccine being the beginning of the end. But we can't let down our vigilance right now because it's not going everywhere all at one time. So we've got to incrementally work our way out of this with our vaccinations. But testing is still available. I recognize that, testing is not, I just go here and I get it for free and they just give me one. You have to read the fine print. We do have testing sites where anyone can go, but everyone's different. At the hospital, to alleviate surge, you can either go through the emergency room, which you're going to have to pay a deductible and things like that, and you still might not get one because of if you don't have symptoms, or you have to have a doctor's order to go to the hospital. Other places are going to ask you questions or fill out forms because of symptoms, because they're not just going to give a test. But we do have the pop-up testing. We had it here before, if you remember. It is due to come back in early February, like around the 12th or 13th. So you can watch our website for further details. They, of course, are doing pop-up testing around the state. But it's not as simple. I think people get in their mind, I can just go anywhere and walk in and get a test and have my results within 24 or 48 hours. And that is not the case. Every testing site is different, and you must inquire and call before you go or find out when you get there. Vaccines, you hear, are beginning to just incrementally work their way out. Of course, they're following the CDC's panel protocol, but everyone is probably listening and tuned in to that, as we all are. And again, we'll work with our state, our governor, and our officials to get it out in Pennsylvania and our county specifically as quickly as we can, as it's readily available. And again, our hospital, our nursing homes, our emergency management agencies are working with all of our officials to do that in a way that hopefully by spring, that's what they're talking about, that, we might have some drive-through sites where your common citizen would be able to just drive through and get it. That's a very hopeful timeline, but I'm gonna take the positive side here.
We have only about a minute left, and I think, Robin, you just answered my question about whether or not the state has been in touch with the county about distribution plans. Evidently, they have not. In fact, as of yesterday, Pennsylvania and Puerto Rico were the only two areas of the United States that had not published a distribution plan. So we're waiting with bated breath, everybody is in Indiana County, for that to happen. So our county commissioners, Mike Keith, Robin Gorman, Shireen Hess, you've been with us for this past half hour. We've got 30 seconds left. Who wants to make the final statement?
Hey, Todd, I'd just like to send one thing out to our county residents. I want to send a big thank you out to them. Through this whole thing, they have stepped up in many ways. They're out there helping their neighbors in need. You have people who have actually, throughout this, have been putting on events to help out different organizations survive. I've heard, so many things, especially like even through the fire companies, of people actually sending donations in to keep them going. Everybody that has been out there, they have not been. They've been very good about supporting and keeping everybody in close eye. And please continue doing that. And again, we will get through this, but a great job on everybody's behalf throughout the county. You've done a great job. Let's keep it up.
Thank you to all three of you for joining us here this morning. We appreciate that. It is the voice of Indiana County, WCCS, 101.1 FM and AM 1160. Fox News is up next, then Josh Whittison from the 700 Shop.
101.1 FM and AM 1160 WCCS, Homer City, Commodore.
WCCS, CCS, CCS, CCS.